folks. Welcome back to the iHealth channel, iHealth Radio, the NBC Network, with your host, Hurricane H. New day, new show, a great topic, awesome guest. We're going to talk about some great stuff that is important in today's age, I would say, and we're talking about wellness, and solutions for wellness, because I think that's everybody knows what wellness is, or at least understands the meaning of it, but do we have solutions, and can we find solutions? And, my guest is going to ask those questions, the tough ones, the $1 million question and the $1 billion questions. I got to be here today. So with me, I have Dr. Katherine J Sullivan. She is the founder and CEO of 360 Wellness Solutions. She's a former member of the U.S. faculty in the Division of Biokinesiology. Did I say it right? It's a
Biokinesiology. Yeah.
biokinesiology. There you go. And physical therapy. Yeah, that's a lot of stuff. Well, doctor, welcome to the show. And yes,
Thank you.
since I'm talking about this, tell us a little bit about yourself and your background, because you got tremendous stuff. I mean, I can read, for 5 minutes your bio, and it's not going to be enough. So go for it.
Yeah. Well, believe it or not, the reason I'm in healthcare is because my mother was 32 when she died, and I was 6. So that was in 1963. She had cancer. It had spread to her spine. And because of that, she was in a wheelchair. And so at 6 years old, to lose your mother, I can remember my dad coming upstairs, laying next to me, and said, "My mommy went to heaven." And the next day, we started making plans to go back to his family, which was in Wisconsin. So I kind of jokingly say, my mommy went to heaven and I went to Wisconsin. I went to Milwaukee. It's like, and when you're a little kid, you don't realize what happened. I'm like, well, where's heaven? I want to go to heaven. And so that became really important to me, was trying to find my mommy, and other people were kind to me, but there were a lot of people that weren't, because my dad didn't know how to raise 2 kids. And so he bought a jacket for my brother, and he got the same one for me. So, I went to school in a boy's jacket. It's just a little thing, but you can remember getting teased for that, right? And so then when I was in 8th grade, they asked, "What do you want to be when you grow up? What's the career counselor in 8th grade?" And I said, I said, the person who works with people in wheelchairs. And so the counselor didn't know. So she goes, "Oh, physical therapist." I said, "Good, that's what I'll be." And it was it. After that, I decided in 8th grade to become a physical therapist and to work with people in wheelchairs because of my mother who had cancer. And it's been 40 years in healthcare, and watching the changes that are going on right now, it's just remarkable. And I left USC in 2012. It was right at the time that the Affordable Care Act had been considered legal by the Supreme Court. And I just thought, you know what? I don't think people know what to do. So I actually left the university and I went into the community. Oh my gosh. I had no idea what I was going to say. I just, but, the reason I did it was I was working with students and taking them into the community, and no food, no ramp, no power. They might have a house, but there'd be no windows. And you're going, what is going on? It's like there's this huge gap between what you think's happening, what you've taught your students, and what's really happening in the real world. And so then, like you, and I have to say, I really admire you because, you ask questions and you're really into wellness, and so am I. I'm like, everybody should be well, whether you're sick or not. And which is kind of a weird concept for people to think about, that as you get older and you get sicker, that you can be healthier, a healthy sick person. And then COVID hits.
that thing.
So all I can say is, I don't know, Hurricane, how many pandemics have you been through?
Well, that would be it. I think most of us in this world, we can talk about the pandemics that may not be, as promoted, but they're real. Cancer is a pandemic. We just don't say it that way. Diabetes is another one. I mean,
Yeah.
there's some ongoing ones,
Yeah,
but
right. Chronic health issues. This is a
ex-
very good point. But in terms of an acute infection, it's the only acute pandemic that I've been through.
it's
So
a it's a it's a one-time century thing.
right. And there's the one unifying event. So I'm saying to everyone, hey, guess what? We have one thing in common. All over the world, we survived the pandemic, and it's like, wow, that could be a very powerful unifying observation that for the first time we all have one thing in common.
We do have a lot of things in common. We just don't look at them anymore because I mean we are all human, right? And we all
Well,
supposed
you
to
know what
live.
I mean.
I
It's
know, I
like
know, I
kind of,
know.
yeah, it's like it's we have this sickness in common, but there's so many things about us that are the same,
Oh
you know.
yeah.
Yeah, I mean, we all got sick from the virus. That proves we're all the same.
Listen, it doesn't discriminate. Viruses, they don't care
Right.
where you are, what's your economics and your background, your ethnics, ethnicities rather. Doesn't matter. You're just a target.
Yeah.
And it does its work. And sadly some people, have we've lost a lot of lives, in that pandemic. And I mean many survived, of course, but it was tough. But you're right, doctor. It's one of the things that it kind of opens your eyes to the real world. I mean, who knew, right? Like 2019, it was just something that you hear that it was somewhere overseas. There is this bug, right? And then all
Right.
of a sudden, the whole world comes to a halt, and we face the real thing. I mean, you have lockdowns, you have people, morgues that are in the streets. I mean, literally, it was just brutal. And
It was
but
brutal, and I think we've. It's sort of like giving birth to a child. You forget how bad it was, and it was like it's kind of like we've forgotten how bad it really was. But when there were piles of bodies, lined up on the ground, and they had to triage people into the hospital, the ones who could live versus the ones they knew were going to die. They just left them outside to die, and you're going, it was that bad, and we tend to forget that.
no, doctor, that's a big one. I mean, you're right. I mean, you can see your loved ones. People were dropped, and they can never see their, and they lost people without even saying goodbye. I mean, it was just
It was
tremendous. A big, big, big
awful.
psychological,
Yeah,
impact. I mean, the mental health itself was, you know, post, COVID. I mean, there's an incline in mental health and I
yeah.
guess issues and I mean and I think from the health perspective people did make it. I mean, we are a resilient, species, right? We can adapt, we can do things, but
Yeah, it's something. Okay, so let's talk about who's made it and who hasn't. It is survival of the fittest. So it is a Darwinian thing that those who did die were not the strongest. Their immune systems were not the strongest. That's why some got the virus and died, and others didn't, and others just were more sick or less sick. And I have one student who came from India, and he said that his whole family was affected, and everyone was very sick, and only his dad and he were not sick. They didn't really get it, and they were not sick, and his mother died. Okay, so he's in his 20s, but he's like, how can that happen? And it's like, well, you have a house full of people with normal immune systems. You have two of you with really great immune systems, and then your mother had pre-existing condition. So it's just biology.
well, thank you for bringing that. So we're gonna touch on that in terms of the
Yeah,
wellness piece because that's the biggest thing, and there's so many factors that do impact why some of
right.
us are. I mean, besides the genetic stuff that we can touch on, and even that, it's there's debates about that, questionable things about that, but the fact is, some of us are more, I guess, prone to getting these diseases and maybe get affected further than someone who's got a better immune system. But so before we do that, I just want to talk about like your story, because that is that is a very unique story in a way. But many people probably have gone through it. Your childhood, right? It first of all, cancer is not new. It's been in existence, but it is on an incline. I mean, the increase rate is just phenomenal, right? I mean, with everything, we almost are feeding this beast, across the world. By the way, your mom was in a wheelchair before she died, and cancer was in her spine, and my dad had the same thing. I mean, I
Oh,
was
really?
older. I mean, he had prostate cancer metastasized, to the
Yeah,
body,
that's
and
what happened. Yeah,
and
she
and
had
and then
lymph. Yeah.
exactly, and it was in his spine, and like there was like multiple spots in the spine. He got paralyzed for
Yeah.
a few months before I mean, he went to heaven. So same concept, but the fact is, so I can relate to that literally from a personal experience, and I've seen that. Now, obviously, I wasn't six. I mean, I was, in my 30s, so it was a
Uh,
little different. So you accept it differently, but nevertheless, it is brutal, and you can see someone going through it. Maybe it's a blessing when you're that young. You may not, feel the same, but yes, living, not having your mom, I'm sure that is a whole different impact, as you said. One, there's we can talk about parenthood and single parents and stuff. It is a tough job, and we've had actually shows that talk about, like,
yeah.
how when you're a single parent, there is a balance when you have both parents together, right? And when someone is not available, especially at a younger age, there's different things you try to compensate, but you're never going to be the
Yeah.
other party, right? So there's that. But I have to admire that you were able to make that call early on about what you wanted to do, and you wanted to make a difference because you didn't want other people to be in the same place, as what you've experienced with your mom. So that's actually, I mean, 40 years later, you've been doing the work, and you've been helping
Well,
a lot of
it's
people.
interesting because my brother, I have one brother who I've my dad remarried, so there's five of us all together. But the one who had me and him had the same mother, he goes on to be an engineer. Now, an engineer with an MBA is like someone with who's from the geek squad, so it's like everybody there's the nature versus nurture thing, right? So my nature was probably more like my mother's, actually, going into the health fields. And a woman who went to college, she went to college, I went and got my PhD. And the reason I did was I was really interested in just learning, and I love teaching. Okay. And I wanted to teach in a university setting. So I had to go and get those advanced degrees so I could continue to go up the academic ladder. And that's how I ended up with doing the LEAPS trial, because that was a NIH funded clinical trial. Okay. So we're talking about a $13 million grant. So then now you're getting into the economics of healthcare, right? And to me, what's really interesting is what you and I talked about earlier. There's so much focus now on the money of healthcare, the business of healthcare. And the part that I'm intrigued with is, how do monetize wellness, right? And actually, I believe it's you don't get sick.
Well,
The
so
best way, the best medicine is to not be sick, is to be well, right?
so that's the big discussion right there, because
Yeah,
I mean, we can talk for days about this and probably won't find, a quick answer to it, because that's the challenge. So we have wellness in one side, which is like being nice and healthy, right?
yeah,
Vitality, the whole nine, living alive all the way to the end without illnesses or light stuff. I mean, you certainly can still get, but your body is going to be in a perfect shape form to be able to defeat any outsider, influence, flu, whatever, bugs, whatever. It can do better, right? But now you have that as what we all should be really working towards. But then, as you said, there's a healthcare system. Then there's other industries that kind of impact the healthcare system. Whether, and again, by the way, some people do refer to it as sick care system. In
I
because
think it's
as a
probably accurate. Yeah, but
because really,
yeah,
you go to the system when you're sick. You don't go to the system when you're healthy, right? And
right,
that's
right,
not a fact. And there's factors. You mentioned something very interesting as you were out there, and I think you have some stories in your website stuff about how you with the ACA and stuff, and you went out there and you can discover how people, may not have the same things that they need for a better, environment to thrive in. And you're talking
right,
about, determinants of social health, kind of social determinants of health, right?
right,
That's a big deal now. It's a common terminology that's being used. Insurance companies are using them. Healthcare facilities are using them. They're looking at the source of where these people, can have vulnerable, they're vulnerable in some areas, and therefore they're not able to afford maybe better food, better,
Right.
healthier
Yeah.
stuff, right? And therefore their, I guess, lifestyle may be, more gearing them towards bad outcomes, obesity, diabetes and all the bad things, right? And it's a fact, it is statistically, sound, but there's more to that story.
Right. Exactly. And that's what's intrigued me about the way you approach the problem is first off, it affects all of us, right? Because if we're spending a lot of money on healthcare, or and like mental health, actually for me, I don't even call it mental health anymore. I call it brain health. So either you have a healthy brain or you don't. If you have an angry brain, you're violent. If you have a happy brain, you have sex. Okay, good. So there we are. We have, it's about your brain. Okay. But what's the difference between sex and intimacy? See? And so there you're really starting to get into the issues of the social determinants of health, right? And I really, really, really believe that because of how things have been politicized, we've actually missed the boat here, or we haven't missed it. We're gonna. I really am optimistic about the use of technology, and I hate AI. By the way, I just like first of all, I'm like artificial intelligence. If you think of it as like artificial sweetener, it's not real, so it means you're stupid, right? AI. You're not using your brain to get to something that has social impact. So if you look at the bottom of our website, I have a joke. It's my joke. I don't know if any of the world doesn't get it, but I have social impact AI.
I'm trying to see where it is on this side right now.
Yes.
I'm
Go
looking.
to the very, very bottom. You go to the footer, and it'll say, "This is our company believes in social impact AI, artificial intelligence." It's a joke because, but no, it's not a joke. I'm serious. I'm like, well, first off, it's not artificial intelligence if in fact you're having a social impact. It's an oxymoron, right? So I'm saying, so why don't we just not call it mental health? Let's call it brain health, and not call it AI, call it make a difference.
I like that.
You see what I mean?
That's a
So
different angle.
it's a different angle, but here's the good news is if things are systematically wrong, it's very easy to make it systematically right. It'd be way worse if it was total chaos, right? But given that it's binary, I mean, everything about AI is yes or no, right? So it's either yes, you have insurance, or no, you don't.
Right.
And I think, what if the question was, why are you here?
Now you're getting deep.
you,
Now we're
you
getting
see,
deep there.
yeah, right. If you just say, well, why, yeah, like you said, you don't go to the healthcare system because you're feeling well. You're coming because you have a health problem. So tell me, what is your problem? Before you tell me, can you pay for it or not? Because if the answer is, I have no insurance, and then your answer is, well, then I can't see you, it means you don't get healthcare, right? But if the question is, what's wrong with you? And you say, well, I have a toothache, but I have no insurance, then I'm going to say, I have some dentist that'll see you within 24 hours, because if that tooth infection becomes a brain infection, we've got a big problem, right? So it's more like, and really, I want to ask you about this, being that you're in managed care, is like, what if we did the first strike you're in rule instead of the third strike you're out? By the time you get the third strike, you have a big tumor in your head, you know?
Well, so there is at least in the space I'm in, right? In the
Yeah,
the government programs, so Medicare, Medicaid,
yeah,
there is a an encouragement from the insurance space for preventative, right? I mean, and again, insurance are payers; they want to pay the least, right? So technically,
right.
we don't want people to be hospitalized or going to the ER, right? Those are the big bills,
Yeah,
right? So just from a financial aspect of it, there is an incentive not to promote that, rather promote health and healthier preventative measures and things like that. So there is
Yeah.
a lot of work that's being done. As a matter of fact, talking about social determinants of health, that's actually one thing that all the health plans have taken as their baby, because it's a big component now as to like what's the problem. So let's try to fix. Many plans now have even introduced, let's say, food and other stuff, gym and things to help people stay healthier and better, to combat maybe diabetes, obesity, and all the stuff that high blood pressure, and literally, especially in the cities, right, in the inner cities and things like that, it's a little bit of a higher incidence than maybe in other suburbia, right? So there's
Yeah.
all these things. So they look at these. I mean, there's literally departments that are just sitting there looking at statistics and looking
Right.
at all
Okay.
these.
So on this point,
Yeah.
so the health plans do a lot of data mining, right?
Yep.
Let's mine the data and we're going to figure out what the data tells us. Okay, first off, that's not science. That's data mining. Okay, that's marketing.
Oh, it is. It is a fact. Yeah.
Yeah. Okay. But what if you said, we're going to try to change the outcome of healthcare. So how do you know that the health system is in system failure? Do you know what it is?
Uh, Go ahead.
It's actually maternal death. Maternal death is the World Health Indicator of public health system failure. And guess what? The maternal death rate is going up in the United States. So what that means is our public health system is failing. Okay. So being the nut I am, I'm like, well, the reverse engineering would say if that's the indicator, then we need
Fix it.
to fix fix that problem. So, and of course, what do the health plans do? Oh, we have doulas in Midwest. Okay, wait a minute. That really doesn't fix the problem for the mother with 5 kids, and one of them is ill, right? So the health system is geared towards pediatrics, adults, and seniors, and it's easy for them, right? So we dichotomize these 3 groups and then we treat them accordingly. But the mother might have 3 kids who are under 18, 2 kids that are over 18, and an aging, dying parent. So from her perspective, which one is the patient, right? Mm-hmm. And in fact, she might be the patient too, because if she's not able to get food for her kids, then we blame her for not feeding her kids, for the fact that they're all fat and they're not exercising. And I'm like, she's lucky she can get up every morning. So here's my idea. Do you have an animal? Do you have a pet?
I do have 2 cats.
You had 2 cats. Okay. Who makes an appointment for your cats to go to the vet? Your cats?
My daughter.
Okay, great. Okay. So you have somebody, right. So the point is you have a responsible person who will make the appointment for the cat. All right.
Right.
And when your dad was sick, somebody had to do it for him.
That was me.
So that would be you. Okay. Now, for me as the mother, I wish that people did things that made it easier for me to be a parent, to be a mother, and in that case, we're talking about a matriarchal model instead of a patriarchal model or a monetary model. It's like, well, what if we solve the problems of maternal health? And actually, all we do is take care of her, because guess what? If we feed her, she'll feed the kids.
Doctor, you touching on some powerful stuff, and we can just backtrack a little bit, because there's more to this, right? I mean, first of all, you talked on the concept of insurance versus non-insurance. Can I get access to not get access? And that's a fact, actually. In the States, it's really sad that those that have plenty of money, and we're not envious here, so people can have as much as they want. That's great. They can afford the best of the best of the best, right? And not only afford when they're sick, but they can afford a healthier lifestyle, so therefore they never even get too sick, right? And then you have the people that may have nothing, and now they have government help, so they potentially have a little better. And you also have a big portion of us, the 80%, plus, that may not have access to adequate healthcare because they just can't afford it. It's too expensive, or they have to pay a higher premium to buy into it and with high
Right.
deductibles.
Yeah.
So they avoid, going stuff. But I think the issue, and by the way, and that's one piece. The other one is you're talking about the mom, and what you shared as a statistic is that we have a higher or an incline in, maternal death, which is not a cool thing to hear about, not in one of the probably well, I wouldn't say that we are currently the most advanced. I think we've lost that. But we used to pride ourselves as a as a
Yeah.
as a country that
We're the most advanced for rich people. Yes.
well, I mean, but historically we used to,
Yeah.
like, in the last couple of decades, as you said, you've seen this, in the last
Yeah.
40 years plus, we used to claim that we were the best at everything, right? And we were
Right.
higher, more than
Yeah.
most of the countries. But now you have people from, I would say, even third world countries that are catching up to us in areas and maybe even better than us in rates, which like that should be an eye opener for all of us watching and listening. I mean, around the world. And by the way, this is a worldwide show, which means that
Right.
anybody living somewhere in the world, they would be like, are these real statistics? Yes, they are. I mean, you Google it up, ask ChatGPT. Since we talked about
Yeah.
AI,
Yeah.
tell me the statistics about what's going on in the healthcare system, infant mortality, maternal that, and all this stuff, and you're going to see comparables that or comparisons that are like literally like shocking. And so you will see these things and you'll be like, what the hell? As you said, there's a lot of data mining that data is available. The question is what you do with it. Now, I think what we need to address is really, and by the way, this is one thing that I've been trying to do through different
Uh-huh.
shows, is given enough information about preventative through different mediums or medians, right? And one of them is really, for example, health, right? Has to do with adequate food, right? Adequate
Yeah.
exercise. So fitness, well, like the food supplies, all the stuff, the nutritious piece of it. And that's a problem that we have. That's what I said. We have, I know 360 wellness solutions. I think your concept should, encompass the whole thing as a 360 factor, right? And
Well,
and
that's
there's
all that yeah, that's why we came up with that name and the branders that we were working with at the time. Our logo actually is 4 elements of health
huh?
for one person. So you're a person that has medical needs, body system needs, you have physical needs, your nutrition and your strength and so forth, oral health needs and emotional and spiritual needs, all of those things for you. And now if your son is in a car accident, is in a coma, he has all medical needs and you have all emotional needs. See? And so those 4 needs never change. And so now you have a family of 4 or 5 people, mother, father, whether divorced or not, but every single person is their own biological specimen, right? And now
That
you
is
put
true.
a group of them together and you talk about family health. So now you're going from individual health and individual wellness to family health and family wellness. And then we'll just throw a pandemic on top of it, and then we stick them all in a room and we put the kids on an iPad, and then it's over, and then you're like, they're addicted to the iPad. That's the mother's fault. No, no, Apple gave them the iPad. you know, I'm just saying, it's like everything has an effect.
In
Okay.
effect.
Everything has an effect. So now I'm saying, okay, it's 2024. Let's get over it. We have to get over it. And if it's not broke, don't fix it. But it's broke. So let's fix it. So it's like, what can we do different than we've done up until this point? Because now the opportunity is to focus on wellness. All right. So I'm gonna give you some examples and you tell me if this sounds good to you. You're a mother, you have a kid who's a juvenile delinquent. He, took a car, he's 14, drove the family car around the Rose Bowl, and the police pick him up. That's my son. And he's not a bad kid, right? Now, we have 2 choices. We could put him in juvenile detention, or we can put him on a chicken farm and he has to take care of the chickens.
If you ask me, I'd say put them on a chicken farm. That's another story.
Right, that's right. You can go to the free range chicken farm, which I've written some of this stuff on LinkedIn going, really, we can put our people with dementia on the chicken farm. Every day, they're going to get up and feed the chickens. And then the kids have to clean up the chicken shit. And it's like, look, if we just started thinking out of the box, right? Instead of saying that the kids have to go to juvenile detention and the people with dementia have to go to a nursing home, what would it look like if you use a social model of health? Because now there's one other big one. When was the last time a parent took their kid fishing? You can't fish with an iPad. So quit complaining about the kids on your iPad all the time. When was the last time you took them fishing?
Oh, yeah, doctor, I can make a joke about that. I mean, they could. I mean, they have these apps that are fishing apps.
Oh, yeah, but this is like watching bass fishing on TV. It's like, what
I,
the heck? My husband was a fisherman. My father, my kids, and honest to God, he'd watch a fishing show, and I'd be like, "Wow, that is really boring."
well, well, doctor, you're touching on powerful stuff. But what it will take is first of all a lot of awareness, a lot of education, and a mind shift. I mean, really, we need to shift the way we do things. And so this is on the individual level, this is on
Yeah,
society, in the school system, in the politics of things, because I think there's also that. Then there's the impact from the, I guess, the marketing impact, from industries, and all the stuff is linked to the same aspect of it, right? iPads exist because it's a good business, right? But it's also being
I'm
pushed
not
upon
giving my iPad up. I love my iPad. I'm not giving it up. But yeah,
what's the
right. But
tool, but how you use it
the
is the key.
tool, there you go. It's a tool, and but it's also a very addictive tool if we let it to be, right? So, you know, you have to think about what the person is passionate about. If they're passionate about playing the guitar, they will actually play the guitar over using the iPad. If they're passionate about dance, they're going to dance over using the iPad. So what you need to do is find out, I think, what are people passionate about? What's your child passionate about? If they're passionate about running, like Forrest Gump, run, first run, just let it run. Because I hate running, so I ain't gonna run. But the
Well,
ones who do want to run will run. And so you see what I mean? It's like people really do have to, and parents need to, and even bosses need to figure out, well, what are you passionate about? And then how can we incorporate your passion into the job? And maybe you can think of a better way to do this that makes you happier, which you're happier, I'm happier, and I make more money because you're happier. you know?
well, doctor,
Yeah.
you're talking about, again, today. You said iPads. I mean, yes, they're a tool. I have one in front of me. I have a couple of phones
Yeah,
right now
right.
in front of me. Plus, it's how you use them, and whether you can control the use of them. I use them for a certain purpose, not for entertainment. Let's say, right? But and even if I did, it would be for a limited time, right? Like when I grew up, our time was outdoors. I mean, we could not wait until we were just running out doing our thing, right?
Yeah.
Now it's hard. Now the pandemic didn't help. I mean, people were locked into these rooms, as you said. You shove, people in an apartment, and everybody's got a tablet or something, and everybody's busy. You see it today. You go out, to dinner or lunch, whatever. And you see people literally sitting with each other across the table. Everybody's grabbing the phone,
Oh, it's
and
crazy. It's
it's
crazy. Okay. Okay. So first off, you said something. It it doesn't have to be this way. People have a choice. Okay.
true,
So
correct?
so then it's like obviously we're not giving them an alternative choice. Okay. So that's why I don't think it's going to be as complicated or as long as you think. If you can actually get to somebody who will let you talk about it, is they need to be less rigid about their solution, which means they have to change too. And it's like, or actually they don't have to change, they just have to listen. Because that's what you're good at. You're good at listening. And because of that, I listen to your podcast. I don't listen to a lot of them because a lot of them are just making excuses of why things are so bad. And you're like, so, one of the things on our website that you'll notice is we started the Just Say Yes campaign. You know why? Because everyone just says no. And that came from the Reagan era, right? Just say no. And I'm like, can't we just say yes to something?
Yes is a good. There was a movie, Yes Man, with Jim Carrey. If you remember that one.
Oh, I love him. Yeah.
Yeah. Well, yes is a powerful thing, right? I mean, obviously, you need
Right.
to learn to say no. And actually, I had that question asked to Dr. Ham. Now, you and I, we've
I heard
connected
that.
literally
Yeah.
through
Yeah.
Dr. Himes, live because you actually interacted with us and asked you questions, that day. But really, that's a big one, right? No, according to psychiatry, it's the personality shift, right? I have my own identity and I say no, enough is enough. I'm gonna do me, right? And so I get that. But yes, on the flip side is also a positive attribute. Change is good, right? And you're right. These things are not complex. Everything that we have literally can change. But
Right.
again, we all can make those changes to our lifestyles, to everything, whether it's food, whether it's exercise, whether it's, habitual stuff such as watching TV versus, walking out, on stuff. Now, you mentioned pets, for example, people who have dogs, they walk out, with their dogs every day. Even if they didn't want to, they have no choice. They have to, right? So maybe that's all we need to do. We should all have pets, and why don't take them on a walk, and we'll have to be forced to leave our homes.
Yeah.
Easy
Yeah.
solution, right? But so the thing is not that it's not easy. It's there's addiction. See, I think that's the other factor. I mean, you talked about, the tablets. Now, the tablet is just a device like anything else. But if you're hooked into it, and you're glued to it and you can't leave. I mean, you start a TikTok, view, and you can't stop. You can be 2 hours later, like, you're still scrolling up and down on
Uh-huh.
every TikTok. I mean, you have so many of those platforms. Nothing against them, but it's how you use everything, right?
Yeah.
Whether it's TV, whether it's radio, whether it's food, no matter what, it's just that. And sometimes it's also a form of entertainment, a form of distraction. Instead of focusing on the right things, you focus on the wrong things, right? And that's also a fact. Now, one of the things, yeah, doctor, you wanted to say something. Go ahead.
Well, on the right versus wrong things. First off, there is no right or wrong. There just is. It just is. It's whatever they chose. So you have to, which is, believe me, it took me a long time to begin to think of it this way because I started off with, well, why are they doing that? And then I realized, well, wait a minute, I don't know why they're doing
Right.
it.
For them,
And
it's the right
so,
thing. Yeah, it's the right
right,
thing for
and
them.
right,
Yeah.
and so I started doing something, especially working with couples of domestic violence,
Mm.
because it's like, boy, that's terrible. He hit her. Well, first off, I made a mistake. He hadn't been hitting her, she was hitting him. So that was one error I made because I just presumed that guys hit women because statistically they do it more. But in this case, it was the woman. Okay. Then my second question is, wow, it's really bad that he hit you, but why did he hit you?
Mm-hmm.
Because it takes two. So you must have done something. It goes both ways, right? So you have the person who hit somebody, but they must have gotten angry enough that they would do that, or they're pathologic and that they need treatment. Or maybe it goes both ways. Maybe the other person provoked them, and you have to really say, you know what? Maybe he cheated on you, but he's also the love of your life.
Why did he cheat? I mean, you're right. Like, see
Right,
that now
exactly.
you
You see
you
what I
gotta
mean?
you gotta dig in to see. Like, I mean, there's always, like you said, cause and effect. There's something that triggered whatever the outcomes or the reactions, or the
Right.
actions and the reactions, right? And so
Yeah.
so it's a fact of real things. As a matter of fact, as I'm listening to you, you know, I don't know if you've done this exercise, but if
I
you were
look,
to
the
literally,
sun's there. I look like I'm right now.
yeah, you got a nice
Yes.
little beam on you,
I,
but
looks like
that's
I'm
a
on my way to heaven or something. Yeah, let me see if I can get, there we go. Let me get
yeah.
over here.
So so
Um,
so
yeah.
you do you can fix it.
Okay.
I'm just gonna cover this, but here's
Okay.
the thing: if we can reverse the timing, right? Let's say we take a moment right now, just take a moment, and really, I don't know if we ever gonna do this, but we can do from a statistical stuff. We can just go back in time, slowly, like almost a reverse time lapse, right? And you go back, and you're gonna see like behaviors and changes are triggered
Right.
by one thing versus the other. The problem is going to the root cause is really going back in time because a lot of changes have changed a century ago, maybe 50 years ago.
Yeah.
Slow changes happened in our society, our economy, the way we behave, the way we live. I mean, think about it this way. Um, Back in the days, the duties, for example, in the family
Mhm.
was were different. And I'm not saying man or women who should be working or not, but
Yeah,
that was the way it was. So there was somebody that always with the kids, for example, given the education
yeah,
stuff, making sure things happen. That changed with the modern way, right? So the modern way is we
yeah,
both work. We have very little time for our kids, for example. So the kids are being raised by maybe a third party or by
uh,
just watching entertainment, or maybe a tablet will be easy to give it to them so they can just get busy, right? So
right,
slowly but surely things have changed. Also, our food, for example, changed. The marketing changed. Everything
yeah.
changed, and so you find yourself today in this predicament or this pickle of all these changes and bad outcomes. But really, there's changes that happened 30, 40, 50 years
That's
ago.
true. Okay, that's true. And I'm like, so what?
Well, no,
So
that's good.
okay, what are is there anything that we can all agree on? So I came up with this analogy. There's two doors.
All
One
right.
door, there's children with Dr. Sullivan. The other door is a door with a big question mark. And in the middle is a pile of machine guns. You can have a machine gun and go through the question mark, but you cannot take a machine gun into the room with the children. You have to put it in a locker. I don't care how many machine guns you have. You just can't bring it in the room with the children. Do you agree or disagree with that?
Oh, I agree with you. Well,
Perfect. Okay, stop.
all
That's good
right.
enough. Because all you have to say is it's not about the gun, it's about the choice. And we're just saying there's one rule. You don't bring a gun in a room with children. Think of how many people that would be saved if we did that.
By
And
the way,
then,
that's an
yeah,
argument that we hear all the time, right? It's not the
right,
gun, it's the individuals. It's a fact. By the way,
right.
it's not the gun, everything.
But you
Yeah.
also have to have a rule, and the rule is wherever there are children, there is no guns. Now, if you put a gun on the dashboard and your kid's in the seat next to you, or you buy him a gun for Christmas and you teach him how to use it, he might shoot you
It
because
happens.
he's a kid, he doesn't know. And then we treat the kid like an adult. It's like, okay, wait a minute. Now, if you just take a moment and you don't judge and you just look at the circumstance, the behavior, you have to say, well, don't we all agree that a gun should be in a locker around kids? Yes. Good. How come it's not in a locker?
Well, some people argue like you shouldn't even buy guns. That's a whole different
Well, oh
discussion.
no, I don't know a gun. I don't know a gun. Yeah, and yeah, that's another story where people just say things about people. Like people said, I'm a threat to myself and others. So the sheriff comes over here and says, "We hear you're a threat to yourself and others, so we want to see if you have a gun." I'm like, "I don't have a gun." I said, "Do you know who I am?" I mean, even if I had one, I don't know how to use it, so I can't be much of a threat to anybody, and I don't have a gun. So just because somebody said something, right, doesn't make it true, right? And so now you just have so much chance for misinformation or lack of information. And all I'm saying to everyone is, are there few things we can all agree on?
I'm
Like,
sure.
do we all agree that you should have good food, shelter, and exercise? Yeah, we agree with that. Well, good. Then how come there's homeless people?
Is not
Well,
something though.
they right. I don't. I mean, now you get into because they fill in the dot, and I'm like, maybe it's because we didn't provide a chicken ranch. And
Well,
I make, if you read some of my stuff on LinkedIn in the past 5 years, mostly I'm poking fun at you guys because I'm saying, really? Are you listening to yourself? I'm just being facetious here, but a lot of that is what I'm saying is like, wait a minute, if you just take a moment and listen to yourself, you would even realize that's funny.
actually, that's true. Well, it's funny that you said that because How many people do listen to themselves over and over, or at least listen to what they say? Probably not as many, right? As a matter of fact, I use that practice in training. Where
Yeah.
we do trainings, we record them, and we replay them so we can see what we've done to be able to. Because, and believe it or
Yeah.
not, even myself, even on the shows, I listen to the shows and I find myself, making some word mistakes, doing some things. But if I don't listen to them, I'm thinking I'm doing everything perfect. So you gotta. But
Yeah,
unfortunately,
you really, yes, it's
but
good.
when we
That's why I like you. It's really good.
well, thank you. But here's the thing,
Yeah.
doctor. But not everybody has that opportunity to listen to themselves.
Yeah.
If I meet you in a coffee shop right now, right, we're talking. I'm not recording that conversation, so I might have said things that may be hurtful, whatever. I'm not going to be able to know that I did that. Now, if you told me, well,
Yeah.
you were bad, I'm not going to believe you, right? But
Yeah.
had I had a recording of that, I'd be like, oh my God, I'm sorry. Right. So how do we get people to really do that? That's a different story. But you're right. You said something very simple. It's not difficult. We all have very common things. I think everybody is in the pursuit of happiness, health, and wealth, right? I mean, there's no one out there, that's going to deny these three, right? We all want the best of the
Yeah.
best of the best for all of us. But how do we go about that? That's the
Okay,
question.
so I have an an idea on this one too, because I deal with neurogeriatrics. So, these are people at the end of their life. Now, the one thing I'm finding is that people do not like to talk about death.
Mm.
But you need to talk about death because I need to know what your advanced directive is. And if you don't have one, well, then guess what? You can be homeless because you didn't say what you want, right? So the hard part for me right now is how do you get people to talk about death so they have a good death, a spiritual death, versus a painful, fearful death, right? It's a real dilemma. But I've been thinking about this one question. So I'm going to ask you this question and you can tell me what you think your answer is. And no,
Go
no,
for it.
not think. You're going to tell me what your answer is because I know
I'll
you're
try.
thinking. Right. Okay. Where do you want to die?
Where do I like physical location? You mean?
Yeah. Not
Well,
when you're going to die because we have no idea
yeah,
when,
no.
but
So where? I mean, for me, I mean, like everybody else, the answer would be like maybe at home, sleeping with my family. That's like the ideal, right? But that's see for me that question is
yeah, hold
difficult.
on, hold
Yeah,
on. I have yet to have someone say, I want to sleep. I want to die alone in a car under a bridge.
and so I
I
get
have
your
yet
point.
to have anybody say, I want to die in a nursing home.
That's right.
They all
Powerful.
say, I want to die at home with my family. So then one time I'm talking to a nurse and he's Native American background and he's a nurse with Kaiser. This is a funny story. And if he's listening, he'll laugh. And it's okay that I tell him, I'm not going to use his name, but his grandfather was from the Navajo Nation. And he says to me, it was, really sad. My grandfather died in a nursing home. And I'm like, why? And he said, well, they said he had to go to the nursing home. I said, who's they? It was Kaiser. I said, I can't believe you didn't take him back to the Navajo Nation. He goes, I didn't think about it. He didn't even think it was an option that he could just take his grandpa back to the Navajo Nation and they would have been happy to have him and he would have died in a teepee with all his friends. And I'm like, okay, well, that's different than hospice. And when my mother died, actually, it was before hospice, and my dad had her die at home in our front porch. He was pre-hospice. So she died at home with her family around her. And that's a universal truth. That's like gravity.
Doctor, the sun is really beaming on you.
Oh,
Like
oh God. Oh my God. I really do
you
look
have
like,
a halo right now.
yeah, right. Oh my God. It's terrible. Oh, yeah.
I
That
guess
is so
the
weird.
energy is just so big. That you're lighting up the
Oh,
room here.
yeah. Oh my God. Oh, look at that's even worse. Okay, let's see if I can move it
Well,
forward.
so while you do that,
Yeah.
let me just touch on a couple of things you talked about. Well, one,
Yeah.
first of all, I think that is a powerful question about death, right? Um,
Yeah, it
you
is.
know,
I mean,
that is a fear thing, right? I've talked about. Remember the show that you listened to? We talked about like everybody fears something, Now, yeah, death is the only thing that is guaranteed or certain in life. I mean, it's so funny and ironic that the only guaranteed thing in life is death, right? Everything else
Right.
could be optional, but that is not. And you're right. We should be always prepared for it. I mean, at the end of the day,
Right.
oh, much better. At the end of the day, it would happen no matter where. Ideally, of course, you want to be where you ideally want. But you're right. You talked about also something about choices and decision making. You're right. If someone cannot talk about advanced directives, like for example, with my dad, we had advanced directives. I actually consulted with people about what to do with his case because that was
Because
for
you're intelligent and you want to learn, and you take for granted your your natural proclivity is to learn.
but we all are.
Okay.
I think we all have that.
No, no,
Do
no,
we? Well, no. Do we?
no.
Do we use it or not? I think that's the story.
Right, exactly. I mean, yeah, I mean that's the political, right? You aren't learning, you're just mimicking whatever someone told you, right? But you are different. You have to understand that when you're someone like me who's been in healthcare a long time, there's one thing I know, you're going to be just who you are.
Well, it's a fact,
And
and,
so
and
I have to accept you, whether I like you or not, really is not the issue. Is that can I accept you and help you understand when you should change your perspective on something? Because as a healthcare professional, my job is to heal you. Okay. So guess what? Your body is wrong. There's something wrong with it. Therefore, you have to listen to me, or your family needs to listen to me, or you see, or unless I'm just not a very good clinician, but the good clinicians listen. And now, and this well, managed care is really hard for me, is who's managing the care, the health plan or the doctors?
well, that's a tough question too. I mean, I
No,
have
it's
this.
not. You
Well, I
you
mean,
have you have formularies that we have to do, and it's like, wait a minute, then you're not listening to the doctors.
well, you're
And I'm
right.
talking about the physicians, but then again, they're believe me, I understand that there are a lot of complications on social determinants of health, and one of them is the greedy doctor. But there are other doctors who are healers.
So let's talk about that for a second, Doc.
Okay.
Because there's a couple of things. You're right. So uh, when I said about that's a tough question, I mean, all the tough questions have easy answers. The problem is the reason they're tough is because we don't want to face the music, as they say, right? I think that's really what it is.
Right.
You're right. I mean, there's the insurance. Now that's for someone who has insurance, right? The insurance does dictate somehow where you go, where you get, how much, what formulary you use, what drugs, and so on and so forth. Those are designed, right? And sometimes they don't work for you, and you got to fight, for your right, as they say, to really get something. I mean, I've my mom's been in the hospital a couple of months, last couple of months, and I had to really argue and do things and then spend time with her, and be with her at the facility to make sure that she gets everything that she can. And even that, they were still missed up a couple of things, right? So I can tell you,
Right.
if I wasn't there, she would have been completely, in their mercy. So, and I'm not saying they did a bad job. I'm just saying that it's a tough system. You got to be there. But you're right. There is the concept also of there is a good percentage of doctors that are really out there for the oath, for the doing the right thing, for caring, for making people healthier. But there's the business aspect of things today. I mean, a lot of people would agree that in medicine, it's a profitable, piece of things.
Okay. So on your mother,
Mm.
it's kind of interesting because similar to the the nurse who had the grandfather who's from the Navajo Nation, why not take her home? And if we talk to the health plan and say, look, it's cheaper for us to take her home and have the right care that she needs, because you should not be caring for her. She's not, she should be taken care of by health professionals who are responsible for her care. So that's another thing I've been thinking of. What's the best way to keep someone from being homeless? Keep them in their home.
Oh, that.
So
Well, doctor,
yeah,
she no. When I said the hospital, she had pneumonia. She had no choice. She was in the hospital to get clear. But
right.
but as soon as we brought her home. I don't
You
believe in
you
nursing.
are you are so lucky. I mean, she's lucky. Everyone in your family is lucky because you're an advocate for your family. See,
Try.
and that's that other thing that when I talk to people like you, or I talk to people who are just good people, like I crazy question. So, I hope people don't get too offended. Usually everything I say, half people get offended. But do you hate your partner?
Well, I hate my partner?
Yeah.
No, on the contrary, not at all.
Okay. Guess what? Thank you. Thank you for not hating your partner.
Well,
Because
you're
no one
welcome.
ever says thank you. No one ever says thank you to the good guys. And so we're constantly judging the bad guys, but no one ever says thank you to the good guys. And there's probably 90% of them are good.
Well, I
And
would
we
say thank
focus
you
on,
too. Thank you
well, thank you.
for the grad. I
See,
mean, to be honest with you, being grateful is a great thing. I have to say, it feels great to hear it. I think we don't spread enough of it. We should.
but it's
And
a weird question. So you have to ask a difficult question. And so the difficult question is that, or the difficult question is, where do you want to die? Or do you want to die in a pink casket with a big old cross on it? Good, I'll make sure it happens. But you have to tell me what you want, and then we can make it happen. And so now you're starting to talk about the things that nobody wants to talk about. And at least
discussions.
it's, yeah. Well, it has to be something where people are willing to do that. So, it's not the right time to start talking about incest. It's
But
like maybe that could come later. but if we just start with, can we take a kid who peed on the sidewalk and send him to a chicken farm versus juvenile detention? That's an easy one. If we could, think about what would it take for someone to live and die at home versus hospice in a nursing home, right? You won't know until we start talking about it. That's why I was really glad that you invited me to come talk to you tonight, because I'm saying, yeah, what I'm saying is crazy because you hadn't heard it before. It doesn't mean get wrong. See?
well,
And yeah. And it's
no,
just like you have so much power. The people in the media do have a lot of power, you know? You have the bully pulpit,
well,
and now
doctor.
it's global.
Well, here's the thing, doctor. So there is media and there is media, right? you know,
There's what?
there's media and there's media, right? Not all media is
Yeah.
made equal, right? Not this discussion may not be something you will hear, all the time or anytime in the regular, right? So podcasts, I think, and radio talk shows are the wave of the future. They give a different spin on things with experts such as yourselves.
Yeah.
And unfortunately, I mean, there's great guests that come on to mass media stuff, like it's mainstream,
Uh,
but they're basically on a particular theme or topic of discussion of the hour, whatever. They get the experts for whatever that situation, but not the overall lifestyle and things that, like the discussion we're having today. I mean, what you're saying is as real as it gets. Even, for example, you mentioned hospice, right? People, as you said, this is a new terminology, but it's basically end of life, right? And what it means that you have, by the way, the option to stay home. People don't even realize that you don't have to be a facility for hospice. You can be home and get all the care. My dad had all the care at home.
Nobody gives them the choice. So that's when you have to say to whoever they are, they weren't even given that choice. And it's like, and that choice could actually probably save money and create more in the family. Someone's dying here, but how the other people are dealing with the grief, they might be less sick after that person dies, or they might be more sick if that's the primary breadwinner for the family, right? So I'm just thinking that the social determinants are helping. We have to start thinking about family health. That's I guess what I'm thinking is, if someone's sick, they're not the ones you should be asking What do you want? It's like, no, it's too late. You should have asked that before they got sick.
Well, so there's a point that thank you for bringing that up
Yeah.
because it is a piece of advice that I'd like to share since we're having this discussion, and it's powerful because you stated this. The idea is, as you said, somebody else is going to be the one talking. The problem is the system will not allow you to talk to anyone if you don't have
Oh, okay. First
documentation as
off,
such.
the current problem is, yes, it's a problem, but it's only a problem because that's the current problem. That's current. The system is the way it is. So I'm saying if it's systematically wrong, it could be systematically. So you could start a what do you call it, a pilot project and say, okay, let's see if they're right or wrong. Is this gravity? We don't have to have Newton to know that this is gravity. So, but if the venture capitalist or the CEO wants to know, is this gravity? I don't know. Let's do a study.
Well, but that's
You
actually
see what
a
I'm
good
saying?
way to that's a
Yeah.
good way to look at things. But here's the thing. So good example, right? I had an argument with my mom's insurance about a month and a half ago because they wouldn't talk to me, and I've been her caregiver for years. I'm the one. They'd never talked to her. Literally, they've always talked to
Yeah.
me. And all of a sudden, a document expired, and we can't talk to you. I'm like, she cannot talk to you. She doesn't understand what you're saying. She's not going to talk to you.
Oh my
So,
gosh.
so
Yeah.
I'm like, which part of it? You see my name. It expired. You can tell me. Just fill a new form. So the reason I'm making a statement for people out there, in order, you always doesn't matter. You always have to be prepared. Have someone else be in documentation where they can talk on your behalf, or because you might not have
Yes.
the ability to do it, and they'll do whatever in the system for you. They'll make choices and decisions on your behalf for your health that maybe will not be to your benefit. Someone else can make that decision, your loved ones, and so your spouse, your kids, your parents, someone else. But you need to and these forms are available in every state, at least in the States. You can fill these forms and have them ready. You can get a proxy, you can get health, a power of attorney. All these are important to have because, as you said, Doc, if you don't have this capability, no, they're not going to talk to you. See, that's the thing. There's some rulings
Yeah.
now.
Isn't that interesting? Okay. It's kind of a good point for us to think about for the health plans. Why is it my responsibility? I'm paying for you not to give me information.
All because HIPAA.
It's like, okay, I'm just being facetious, but being ridiculous kind of makes the point. Also, having health insurance is like having car insurance with no car. If I don't have a primary care doctor or I can't get an appointment for 2 years, why am I paying for insurance?
That's a
So
fact.
they also have a responsibility to make care more affordable and accessible, of which some of the things I'm saying would help, because if you were forced to be responsive within 24 hours, I have an easy way to determine in the emergency room who's got dementia and who doesn't. Can you draw a clock that's 3:15? Yes or no? If you can do it, great. You don't have dementia. If you can't do it, guess what? Bad news. You have dementia. Oh, you don't remember because you have dementia.
That's a good test.
It's such a simple test, and it could be done as part of the screening in the ER. Now, should you ask the person with dementia to consent for chemotherapy? No, you have to
Exactly.
find a family member because they can't consent. But it's, see what I mean? It's like that we're caught in we're a dog chasing its tail.
But doctor, what you said there is powerful because here's the thing. Again, HIPAA rules, blah blah blah. If you don't have a document, they don't care. They're not going to talk to you because it's the
They
law.
should have gotten the document. That's my point. It's like, it's like
Well, that's what we
right. And
say.
so,
Please get the
yeah,
documents, people.
right. Or insurance company, make sure they have the document, because I know the insurance company will say this. Do you have a legal guardian? Yes. I have a dog too. No, I don't. I don't have a dog. If I have dementia, I'm like, I had a dog when I was 10 in the day.
That's right.
That's my favorite line. In the day, I'm like, uh-oh. It's because you don't know if that's a person like you who actually remembers that versus a person with dementia who only remembers in the day.
And well, that so now that touches on something called training. See, I'm a big firm,
Oh
believer
yes, I
because
well,
I literally blasted on this particular person on the phone because she drove me
yes,
nuts. We need a translator and this and appointments. I'm like, you don't need any of that stuff. And all that she had to do literally for me was, by the way, your form expired. Can you just fill out another one, go to the website and do it? And actually, that's exactly what I did. And it was literally
I thought
instant.
yes.
It
You
was
mean
instant.
help you?
Was supposed to be. See now, so here's the thing. So on my side, when I'm working out, currently I'm not with a health plan, but when I work in a health plan, I'm in the business development side and operations side. But I am a, because we're the front line, right? You always would, you're enrolling people into these plans, right? Your teams are. So I am a big, firm advocate for these members because when we bring them in, we want them to be happy. Otherwise, they're not going to be happy, and then it affects all our business, right? So in essence, I even created retention teams over the years because I want to make sure that people have the best experience when they join the plan. And so what I've
Yeah.
noticed, and that's what I told this particular, and once it escalated, I'm like, you know, the job is to, if I'm talking to you and you see my name, then give me the information I need so we can fix the problem instead of being stiff about it and tell me it's the rules. The rules, I'm gonna fix them. I'm gonna get over them no matter what, or I'm gonna change the plan and just
Guess
put.
what? I've some good news and some bad news for you.
Go for it.
Good news is you're a healer.
Oh, and the bad news.
You're not getting paid for it.
Uh,
If you do have the answers. So those of us who are teachers are healers. And we don't give credit to the people who are the teachers. The good teachers have actually learned something new that they want to teach to somebody.
always.
See, and so when you hit on something I think is really, really, really important is how does the brain learn anything? It changes. It actually changes state when it learns something. And I had a professor at UCLA, and he says to me and said, I'm sure he said to every class every year, but and every student went, "Oh, I get it. If you have an egg and you hard boil it, it's like learning. You've gone from a state of you don't know how to read to now you can read. So you can never not read.
It's powerful.
Your brain went from the state of it's a raw egg, it literally changed its physical state. And now you can read, right? And when you get to the point where you've been reading your whole life and you're voracious learner, and then you have a stroke and you can't read, that's pathology. And wow, after that, I'm like, oh, the brain knows how to learn. That's what it is. So that's what brain health is. It's learning, actually. And so teachers really are brain scientists.
Well, so doctor, since I mean we've covered a lot of grounds here. Now I want to just touch on your concept. I mean your four elements of really 360 wellness. You know, they're the core ones, right, for everyone and all families. But then there is the sustainability, and I think you refer to it as global sustainability. Now let's talk about that because in order for us to do this, we need to get a little bit of a buy-in across, a lot of disciplines and areas. So how do we do that, and how do your work, kind of contribute to that?
We just created a nonprofit because I could not get the health system or my fellow health professionals to change because it's like I'm a physical therapist. I hate occupational therapists. I'm a nurse. I hate doctors. It's like, well, no, wait. It's not about us. It's about does the patient need a physical therapist or need an occupational therapist? And I could not get them to budge off of their territory. Then I was talking to a provost and she says, well, we train them to be experts in their field. So they're just acting the way you would expect them to act. I do dentistry. I fix teeth really good. Good. I'm not a dentist. So we have to get the health professionals to think about how do we do a better job coordinating the care that a person needs, right? And that's a whole nother conversation, not related to this, but that is a big challenge right now, because then the health plans have to deal with the fact that the health professionals are actually part of the problem, right? But then again, this goes back to positive reinforcement. We don't incentivize them for doing a better job. Okay, so if you said to an OBGYN, I'm not going to count the number of C-sections you have. I'm going to count how many full-term births you have.
So now you're touching
Because if
on
you have full-term
value-based
births,
stuff.
right, now you're talking about pay for performance.
Mm-hmm.
And you're still having a birth. You're still getting paid per birth, but now you're going to get a bonus for full-term birth.
Well, actually, just on the note, Doc, from a so
Yeah.
again, commercial insurance, maybe a little different, but in the government programs, because of CMS regulations and stuff like that, there are new like there's also like value based stuff now, contracting, right? So
Yeah.
when you actually incorporate these kind of concept, it's performance based. You do X Y Z, you get extra dollars. Makes more
Every
sense.
woman have a pap smear. The bar is so low, it's under the ground.
But you're right. Mammograms, pap smears, these things,
Right,
all
right.
prostate, all the. But you're right. Like, so there is like at least in the Medicare space, we have a lot of measures to try to get doctors to buy into these concepts, and they get an incentive for every procedure or every one of those tests and things that they get their patients to actually adhere to. So even medication adherence is a big thing. So there's a lot of, especially since CMS implemented what they call the star rating, that changed a lot
Oh, yeah,
because
yeah, yeah, yeah.
the star
Okay.
ratings changed the dynamics on how plans behave, in terms of the measures. So they work a lot more with the doctors to try to get them to do certain things. But again, there's money, then there's the reimbursement rates, and there's all stuff. So some doctors have bought into it. Some doctors may not. Some doctors says, you know what, I'm opting out of the managed care. We don't want to be in this. Let's just do self pay. So again, this is where I mentioned the sustainability. Now we have a little bit of a dilemma and a pickle because not everybody's buying into the concept, to the global picture, right? So I'm still doing it as me. I'm the doctor. I have an overhead. I got a malpractice insurance. So I'm looking at that. The other dilemma is, which is true, is that not if not 99%, I think 100% of all health plans in general have been started by some sort of a provider, a hospital system,
Right.
or
Okay.
so
Right.
there is some level of conflict as well because now there's profitability, there's
Okay. So I'm
ownership.
going to go back to this idea with you is I think we have to do a demonstration project of an alternative. Like, for example, the chicken farm. I'm just going to use that as my example right now, but say we're going to have a chicken farm. We're going to put people with dementia on the chicken farm with the boys who should be in detention. And then at the end of a year, we're going to see how much money did we spend, how many eggs and chickens do we hatch and raise, and you're actually generating revenue, healthy revenue, and you've changed the model from a sickness model to a wellness model, even though you're punishing the boys and you're being kind to, you see what I mean? We have to just try something different. I mean, insanity is doing the same thing over and over and getting the same result. So all the things you're saying is exactly true. Okay. But what if we just said yes to anything else? Anything else. And you just said a group of clinicians, because there will be clinicians who are early adopters who would say, I'll go work on the chicken ranch.
Well, they are actually, and by the way, this is not to
Yeah.
discount those. There are some pioneers that test these things, whether it's biomedicine or biodentistry, for example, just to mention a few. But
Yeah, yeah,
also,
yeah.
but even in the value-based, concept, there are doctors who buy into it. There are health plans who make those contracts as mandated, for the way they sign up for new providers. So you don't join them without having a concept of performance based. So therefore, the results, are patient
Mhm.
care, optimum care, and maybe less hospitalization, less what do you call it, mortality. All these things can get affected in a positive way. But again, they say yes. As a matter of fact, the more progressive, I would say, CEOs of some of these health plans can make a difference, can change that. And I think today we have a lot more of the newer brains, the newer minds that are not living in the past in a very archaic, model system of how to administer care, where they kind of look at what is innovative, what can we do to make things happen. And I've seen it even in the hospital setting,
Yeah,
they've
yeah.
advanced.
Yes, I think you're right. I mean, it's called, I think, care coordination. You hear that term,
Mhm.
or integrated care or holistic care. But let's look at some of those models, and then look at the outcomes, because some of them are good. Some of them have great marketing teams that sounds like they're good, right? And so it's so variable. And I guess that's the other, is we have to have some standard that we're holding everyone to. Like when I was a young therapist, we had the regional spinal cord injury. In fact, I saw you were at Jefferson, right?
Yes.
Jefferson in Philadelphia. That was one of the 10 spinal cord regional centers in the country. Now, what came of that, which was great, the AGL levels of spinal injury, and the ABCD for complete, incomplete, and it was 2 levels of incomplete and 2 levels of more complete. And that came from the regional centers, so there were 10 of them, and they had made it their business to try to figure out and understand spinal cord injury. And actually, because they did, they learned about methylprednisolone. And during the COVID epidemic, it was doctors in the ERs that began giving anti-inflammatories, going, this ain't pneumonia. The antibiotics aren't working. Let's try to hit it with anti-inflammatories. And guess what? They didn't have to put them on a ventilator. So those
Until they were
physicians,
given a different directive.
right, exactly. Then politics got involved. But for that magic moment in time, there were some renegade, and actually during AIDS epidemic, same thing. We didn't know what was going on, but there were a few doctors like Dr. Fauci that actually was listening to them and trying something different, and not waiting for the FDA to catch up. And there are a few like renegades out there that are trying things, but then people swat them down. It's like, if yeah,
Well,
you're
doctor,
right. It's challenging. There's no question. I'm not saying it's not, but
well, it's complex. It's a big complex, and I mean solutions we can have. And you're right. It's not difficult. It's the adaptability to the easy, right? It's to adopt new methods, new thought process, new missions. Really, like do we really? I mean, at the end of the day. So here's the thing. And we've covered this a couple of times, in different discussions. Is that here is the question: there's profit to be made. How much profit do we make, without hurting people, without sacrificing the care? See, I think that's what it is. Can it be balanced? It can be. The problem is there's greed factors that actually over
yeah,
literally taking
yes,
over, because that's all there is. How much money do I have to make in order for me to do
right.
this? Like doctors, for example, sometimes even if they want to do the care, and by the way, I do believe in some providers, they want to spend more time with the patients, but the average doctor now is spending 10, 15 minutes with a patient. How much can you know possibly about that patient? Not
Okay,
much.
so yeah, and okay, but I think it has to do with, okay, one, again, I'm going to bring up the technology thing. This is the first time that physicians are even willing to do telehealth. They would never do that. But they had to make money during the pandemic, so they started doing it. And now they're like, It's really good. And to tell you the truth, it is. It's really good. The other day, I was looking at someone. Now, I'm not a physician. So people call me because they're not feeling good. Okay. It was projectile vomiting. It's like, oh my God, I'm sitting there watching this person go, I'm really not feeling good. You're like, oh my God, it's projectile vomiting. And I'm like, you've got to start getting, well, one, you have to quarantine yourself, and I'm going to send over a case of Gatorade because you're at high risk of dehydration. You see, that happened in a telehealth session that I didn't get paid for, by the way, but that was a very important health event, right? And I don't think that we have even gotten close to understanding how we could use technology in a positive way, right?
Again,
And
you're in California, so I think you guys do a little bit of advanced testing on something, and then more tech
well, yeah, we
than other
believe in
parts.
Walmart and Doc of the, and you're going, wait a minute, guys, hold on. It's like, like I want to go talk to someone at Amazon. I talked to a young mother. She's got two babies, and she's working at Amazon during Christmas holidays during the middle of the night. Now she has to get daycare. She needs diapers. She needs formula. And she called me, and I'm like buying her diapers and formula and stuff. And I said, you know what? I'm calling someone up at Amazon and saying, let me open a 24/7 daycare for you, because guess what? And then every week, we should give her a week's supply of diapers. I'm sure someone would donate them. And let's give her a week's supply. And that would be every week. She gets her paycheck, and she's going to get free daycare because she'll be a much better worker if she knows her kid's okay. And if at the end of the week she gets all of her diapers and formula for the week, trust me, she'll never leave.
Like you creating solutions. Again, that's your
Right, it's
brand. That's
solution.
what
Right.
you see a problem. By the way, this is an easy thing for all of us watching and listening right now. Here's the thing. I use this concept as well at work. Like, when a problem happens, it already happened, right? There is a situation that's
Yeah.
already occurred. You're not going to dwell on the situation. And maybe you can find out what happened, what caused it. But let's find a solution for it, to fix it, to cure it, and never go back to it. And that's really what it is. You remedy it and you find a solution that is ongoing, so you never revert back to the original
Well,
problem.
I've got some good news and bad news for you.
I
You're a
love you.
healer.
Go
You're
for
a
it. All
healer,
right.
a teacher. But that's how do we monetize wellness? It's like, if there's people who've got good ideas, why do we shoot them down all the time?
Conflict of interest, personal. We
Oh,
can list
come
the whole
on. Those
list.
are all the excuses.
Well,
But
yeah, yeah.
for your mom, if that person wasn't addressing your needs, then the person you should be talking to is the CEO going, you know what? It's not her fault that you've trained her wrong.
Oh, I did that already.
Right, good. And you can. That's why I'm talking to you. Because I do think it's going to have to be leaders who understand that the system's broken. And we're not going to take it personal that it's broken. We're going to fix it.
Well, doctor,
And yeah, you see what I mean?
I see it and I hear it, but here's the thing: this is not so much just about. I think this is something that can be applied by even your average person. It's really just educating people, in practices like what you need to do. Like you mentioned, advocate, right? Earlier the word, right? Everybody should be an advocate for themselves or for their loved ones at best,
Unless
right?
you have
Or
dementia and you can't do it.
well, then someone else has been already assigned to your
Okay. So
person.
then you have to train the family to say,
Exactly.
you
But
need to, right. You
well, I think
have to do these things. You don't want to talk about death, but guess what? You're all going to die. So let's talk about it. And believe me, I just had this conversation with my son on Saturday. His father, who committed suicide, asked to have his ashes spread across Eilson. They're sitting in my son's garage. He's dead. Who would know? It's about integrity. It's about, he asked you to do it. He didn't discuss it with you before. but it was there in his advanced directives, and you haven't done it. I think, and I bring it up, and guess what? How dare I bring something like that up? Why not? You didn't do it yet. Am I
You're a
a bad
troublemaker.
mother? Right, exactly. It's like, I'll take him up there. Give me the ashes. I'll take him up there. Because you know what? Even though I divorced him, that was one of our favorite places to take you when you were a kid. That's where you learned to fish. That's where you learned to camp with him. And at the end of his life, he was so depressed, he committed suicide. And he's like, well, he was an alcoholic. No, he didn't commit suicide because he's an alcoholic. He committed suicide because he was depressed. See, and then people start making judgments, right? So, I really appreciate you having the braveness to talk to me on the air, because after 40 years in healthcare and, having a husband who was an alcoholic and leaving that relationship for him to commit suicide and have people say they're not going to spread his ashes. And you see what I mean? It just goes like my head's like this going, we have to talk about it.
Well, that's again from a mental health perspective, right? Talking about things is the first rule, right? It's you gotta get out of your system. You can't just talk inside your mind. That's what people get depressed and anxiety and all this stuff. Gotta
Yeah,
speak
and
up,
they perseverate on that. Yeah.
talk about things, share. If you're feeling bad, share it. That's why there's hotlines, there's all stuff. I mean,
Yeah.
in the case of your ex, I mean, sadly, he didn't, have that opportunity. But many people are still here, and they should do that. And as you said, you should talk about that. You should talk about advance directive. We should talk about everything else, because you never know. Things can happen to anyone, any given moment, any day, and any place. That's the other thing. Like to your
Yeah.
question, where would you like to be? We would like to be somewhere, but that's not guaranteed. So therefore, you got to be prepared.
And also, you need to respect your family. You don't have to like them.
That is a fact. Well, I respect everyone. You don't have to. I don't have to like people, but I have to respect them, right?
Well, you do, but that doesn't mean everybody else does. See what I mean? I keep saying that you have to understand how special you are, because
I take it.
everyone has a podcast, and then there are a lot of bad people who have podcasts, but there aren't that many good podcasts. And so, I'm giving you a compliment. So thank you.
I
You're doing a
take it.
good
I
job.
take it.
Yeah. You see what I mean? It's like, yeah, there's all sorts of good people there out there that we're not saying thank you to or listening to.
Well, again, from this platform, let's
Yeah.
reinforce that message. You see
Right.
something good, say thank you. Say, how can we help? I mean, do something positive. Smile on somebody's face. I mean, we talked about this, that a
Yeah.
couple of weeks ago. These are simple things. And by the way, it doesn't take energy from you. It feels good when you say something like, "Oh, I appreciate what you did. I appreciate you." Not a big deal.
Yeah.
Make somebody's day, a good day by just telling them. Some people
Well,
are really
okay.
having a bad
I
day.
want a CEO and a health plan CEO who's willing to make my day. It's like, it's hard for people to change, right? It really is. And it's like, if we all changed a little bit, we could do it. But it really is. I mean, believe me, I've been in healthcare as a physical therapist. I used to say this to my students: if you live, you'll see a physical therapist.
Very good chance.
If you're dead, you're going to see a mortician. But if you're a physical therapist and you work in an ICU, or you're a physical therapist and you work at home, or if you're a physical therapist that works for hospice, there are certain therapists like OTs and PTs who actually work the continuum of care. But some of them just specialize in ICU. So they're right there with the ICU docs and the ICU nurses, right? So why do we not respect each other within our own fields?
Questions.
It's about training, right? It's about training. If we could create more training opportunities where, you throw them all into a room and you say, okay, it's the emergency room. someone's going to come in and they have tooth pain. Guess what? It's in the mouth. It must be something that a dentist and a physician might be able to deal with. I don't know. I really, at this point, I'm hoping that someone like you can get them to think about things in a more integrated way, right?
Well, we can only do the work, right, and share the
Right.
value, share the insights, and maybe someone can see it. And I think there is an awakening today of like
I think so too.
we need to, change is eminent. We need to. I mean,
Yeah.
hopefully to the better, not to the worse. And I think there's a lot more discussion, especially on social media, because it's open, and you got experts now that are coming up and getting good traction. I would say,
Yeah.
all over the platforms, and these are legit folks that know the stuff. And if you are truly, a future, progressive CEO or leader in general, whatever your role is,
Yeah.
you can make a difference. And even if you're not, every one of us that's watching and listening can make a difference by adopting better practices with our own families, our surrounding, our society, our community. There's so much we can do, and we can help each other. And even I think one of the system, like we talk, like wellness, let's say nutrition, just as an example. If
Yeah.
everybody starts, moving away from bad food, then the companies will change the way they do their packaging and the way they put the ingredients and stuff. Just an example, right? And now we
Oh
have a
yeah.
sustainable, food, system that is healthier. And yes, it may not get people sick, and people are going to get sick no matter what, because there's reason for us to be sick sometimes. The environment, there's a lot of things that we can't change immediately, and therefore there's that. But the incidence will be less, and so that's okay. Now, can these providers make profits differently? Probably can. I think that's the problem. Like it's almost like the what do you call it? Like self preservation here. Because if people are not sick, then we are out of business. If people are not this, we can give them
I,
drugs.
I think it's going to be the new clinicians. I really do. The younger clinicians. I think that they're going to be way more open and less territorial than our more senior clinicians who have been kind of trained. It's all they know. It's like it and really is we become creatures of habit, and you know what you know and you don't know what you don't know. And but the younger people really are more interested in the sustainability movement. That's why we're really kind of focusing on what are you passionate about, because if you're passionate about water and you're passionate about building and you're passionate about healthcare, then we can have a water in a building with healthcare. It's like you bundle it,
But you,
and that's yeah, that's the solution is to, like you said, work together.
again, but you mentioned faculty education and training. I mean, that's exactly what's going to happen. More people are going to be trained in a new way, new approach, and more people are aware also and want the better life for themselves, and therefore for everybody else. Because
Yeah.
it's not going to continue in the way it's been. It's just not. Eventually, people are going to see it. You can't hide this stuff big enough. There's a point where everybody's going to like, well, weird, something's off here. It can't
Yeah.
be like just an increase. Sickness. People are going to get that, and they see it already now. So it's just a matter of
Well,
hopefully
I
we
have
can
a
do better.
question for you. Maybe the changes are not in the hospital, because actually, when you get into the hospitals, when you need them to be specialized,
Well,
right?
exactly. Yes, that's
Yeah.
perfect. Yeah.
But if you thought about, I mean, I've just been thinking about this week. Was It's sort of like a neighborhood watch program, only it's the neighborhood health program,
I like
right?
that.
And that's the nonprofit that we're starting is in Cathedral City, where the teenage boys have more guns than the men do. So it's a real problem because they're literally shooting each other. And so it's like, okay, well, let's just try. Well, we're gonna go there. We're like going to ground zero, right? And it's right near two hospitals. So it's not an issue of having a hospital. It's actually an issue of their behavior, right? So yeah, stay tuned. That's where 360 Wellness Village is. It's a nonprofit saying, guess what? We don't know the right answer, but we know people who are in different parts of the healthcare system, like Medi-Cal and things like that. And, we know people who know Melina. And it's like, good. Get him to come to me. We know people who know DAP, people from DAP. And it's like, and DAP's changed. That's the the AIDS project, right?
Mhm.
Used to be you had to have HIV for them to see you.
Well, I mean, that's how they were designed, right? I mean, but again, these are
Well,
systems.
like why not their partner who doesn't have AIDS yet? Right?
That is true. Well, again, I think listen, there's a learning curve, right? So
Right.
that
Yeah.
whole thing, it took a long time, and there's legislation so that's the other thing. Then there's the world of politics, right? There's
Yes.
that also can be putting a little bit of pressure on how things move. You can be all the progressive you want, but if the laws are not, going with you, you have lobbying powers. I mean, this is not a one not over, kind of concept, and he's just going to snap a finger and things are going to change. I mean, there's got to be a lot of buy-in from a lot of areas to change systematically the whole process, and then you can
Pandemic
say,
did it. I mean, look at this. Look
well,
at
they
this.
they did, and
It,
you're right.
it
It's a good
yeah,
example.
it really, I mean, besides people like us who have always been technology savvy, even your grandmother who's exchanging recipes with her girlfriends is new.
It's been technology, yeah.
Yeah, right. And the pandemic lockdown in California was 2020, right? That was only 4 years ago.
I was like an eternity already. But and you're right. Earlier you mentioned something that's interesting that people are forgetting, and you're right.
How
People are
people
moving
was
on. People are
it
moving
was
on.
terrible.
Yeah.
And yeah, in a way, I'm saying, so what? We'll move forward. But then we can't let ourselves say, well, in the day, no, 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 we'll move forward. We're going to look forward, and we're going to, yeah. And I think we're ready. I agree with you on that. I really think that people want to be well. They didn't have any awareness, and now they have it. And the people in Gaza have it, and the people in Israel, and the people in Iran, and all over the world. You can't stop it, which is good.
Well, listen, right now the world is, as they say, global
Yeah.
village. Everything is in the clear with social media. Nothing gets hidden. It's very difficult to limit the access to information. I mean, there's despite the attempts of maybe removing accounts and stuff, people are popping up. They're talking. They're finding a way out. There's so many platforms out there, and really, at the end of the day, uh, if we do want this world to consistently live in a prosperous way and continue without destruction, I think we all should come to the agreement that we should make some shifts and changes towards better
Right.
sustainability, better things without hurting the profitability. And by the way, there's quite a bit of organizations out there that are doing the work to even manufacturers and things that are doing things where they want to do better, healthier products and so on and so forth. So, and they still can generate profits and without that having a deeper impact, I think, on the health aspect of things or even the
Yeah.
environment.
Well, I mean, I really think that you're onto something, and it's wellness, and the monetizing wellness is not cost containment. It's actually early intervention.
Well, but
Really, it's like nip it in the bud as quick as you can, because 90%, I mean, there's no question there are some frequent flyers. However, 90% of people will be better within 30 days. So you should throw the book at them in 30 days. And then the 10% who are the frequent flyers, we pull them out and deal with them differently, because obviously something else is going on. But that's another thought I had too, is like, what if we're the Jiffy Lube of healthcare for outpatient, not for in hospital? You know, it. If we created Jiffy Lube versus an ER, you'd go to the Jiffy Lube.
well, it's funny. You said a couple of things that are strong. One is you're right. I mean, listen, if you get hurt, there's an emergency, you need something. You need the medicine, you need the hospital, you need the emergency. So that's right. but there are preventative things. I mean, diabetes and high blood pressure and cholesterol stuff. Lack of minerals and vitamins and stuff is something that we can take care of ourselves. There's also, I mean, there's a lot of information today that's floating all over the place about, let's say, how we were kind of almost hypnotized on the concept of, like, good sun versus bad sun. Like, hey, don't go to the sun because you want SPF
Yeah.
stuff, and versus, like, you need the sun to get your vitamin D. So there's two schools of thought. You're gonna hear a whole bunch of people say, like, oh, that's gonna cause cancer. The other one's like, no, that's not gonna do it. In the right doses, it will be good for you. Your vitamin D will trigger a lot of things. Your body is gonna respond better, and you won't need to go to
Yeah.
to diabetes and maybe, like, bones issues and whatever. So there's all these things that are happening that right now people are kind of like finally seeing the truth, to a degree. Now, can it be immediate change over time? Maybe, but I think there's enough people out there that are talking about it, making noise, that it can change things slowly but surely. But you're right. If we can do all that preventative, then when the real stuff happens, or the things can happen. We can still be damaged as humans. We're frail, right? Things can happen, but it will not be happening from that obvious reasons that can be prevented. It will happen from accidents and things that actually can occur to us as humans, right?
Yeah,
And
yeah, right. They're there anyhow.
yeah,
Right.
and by the way,
Yeah,
I say this all the time, like, when you go to the hospital, you do want to get serviced, the right way, and get the
yeah,
right medication, the right stuff, get fixed and go home, as soon as possible, and then maintain in a healthier lifestyle. And if we do have that, we'll just reduce that, uh, rate of hospitalization or ER visits and
yeah,
unnecessary stuff. Now, again, someone can in the healthcare say, well, we want all, like I always make a joke. I mean, hospitals are like, basically hotels, right? If they have the beds empty, they're not going to be there for a long time, right? They get hurt, right? So, but
right,
do we want them to just be filling the beds by people that may not need to be there, or for the people who really need them, right? So those are things that will be,
right.
and those are
Yeah,
questions that are sometimes raised by insurance companies, by not so much politicians, but really by advocates and so on and so forth, groups. So there's a lot of work to be done, and this is, again, we're not going to solve the
right.
problem
Exactly.
today,
Yeah.
but
And we're good, but we're not that good.
well, we're, yeah, no.
We're good.
It's gonna take, talking about a village, this is gonna take a whole city,
At least
not a
it's a
village.
good start. It's a
Well,
good start. Yeah.
but maybe somebody listening right now can see some light in the end tunnel of this discussion, and share that value with somebody else, and so on and so on. You never know who that touches,
Yeah.
and that's all there is. I mean, we can only share, the wealth, and let the people take that wealth and build from it. I mean, we don't know.
Yeah.
Like, when you give information, like, one of the things that I always say, we give these shows, someone could listen to them and maybe see the difference, maybe, learn something new that's going to change the course of their life, or maybe, the behavior,
Yeah.
whatever. We don't force anything on anyone. Information is free and it's available. And if it's not for you, it's not for you. But at the end of the day, it may not be even for you, but someone that you may even save somebody else's life, if it's not affecting you directly. But we all know someone who
Yeah.
needs the help.
Right. And I don't know, like this thing that we're doing right now with 360 Wellness Village, I'm working with a veteran. And he's like, I'm from Mexico and we lived on the ranch and we beat each other up and all that. But you know what? Learned a lot from my grandma. I'm like, good, let's create one. And he might be the one, right? And he's a veteran. And it's like right up, and he's motivated to do that because that's what he remembers, the things that were good about the ranch in Mexico. I was like, good, let's just create a wellness ranch. You know,
Great idea.
it's like, I don't know, let's try something different. Let's just try it. It's got to be better than a juvenile detention. And he loves kids.
Well, that example that you stated a few times about, like, changing the shift. Like, do you want to really punish these people, or just discipline them, right? So you can discipline without, like, for example, taking,
We're given an opportunity. Don't even use the word discipline. Say an opportunity to choose
taking
something different.
a
Right.
second chance. Show them the
Yeah.
different way. I mean, you're right. I mean, there's ways to even describe these things, but it can be done. And by the way, I think, if I'm not mistaken, there are areas or agencies and groups, and even, some parts of the world
Don't
where they've
flush
done,
it, but
they've
we need to make it systematic,
oh, yeah,
which
well,
means you have
that's
to
a whole different
replicate
story.
it. Right, right, exactly. It's like I asked a friend of mine, if we can have McDonald's in China, why can't we have a family wellness center? I don't, how do you do that?
We,
Right?
we don't
I'm a
we
doctor. I don't know. But that's what I think we have to start thinking about for the health plans to say, look, you know how to build hospitals. What would a family wellness center look like? I don't know. Let's start talking about that because there is not a place where a mother can go with her multiple kids and their aging parents. What would it look like? You know? And yeah, it's possible. I really believe you. It's possible. Of course, it's possible. We just have to start talking about it.
I'll give you an example. So there's something that we've done in our fitness, program is that we create a family hour where
There you
where
go. Yeah,
where the whole family can work out together, literally kids,
yeah,
whoever, all ages, they can come on and just do their own exercise together. Gives
yeah,
them a little time to be together instead of separating. Enjoy a little time, just like going to movies, but now you're doing something that's healthy for you. So we try a concept like that. And by the way, that
yeah,
concept can be duplicated in a lot of different areas.
yeah.
But you're right. This concept you're saying. I mean, even doctors. I mean, if someone's listening wants to be just to test it out, I mean, they can have like you have family practice, right? They see older and younger folks, right? Well, you can do a family practice plus concept where now you have geriatric,
Right. Yeah, there you go.
and one appointment, and we all can be seen in one session. I don't know. Just like you do it with therapy, right? You go to mental health, and you have the spouse, and you have
Yeah.
your significant other with you to actually talk about things. Well, maybe there's more to it mentally than physical, even in one setting. I mean, there's ways to look at it.
Right. I think they would like that too. I mean, I think they would rather see a whole family for 50 minutes than to see, you know, 5 minute, you know what I mean? If we talk to them, Dr. Fauci, I just was listening to him the other night. He started listening to what the gay population was saying, and they were disagreeing with some of the decisions they were making. And he's like, you know what? They're actually making sense. So he did it their way, and they were right. And it's like, yeah, that would be interesting. That's a really good idea.
Well,
If
there's
the
one thing.
physicians could do it different, what would they do?
Well, here's the thing. The one thing that someone can say, well, how do we bill for like 15 minutes? Well, then you bill, 15 minutes. The rate will be times 5 or 4, whatever. But now you work and negotiate that, with if they're self pay
Yeah,
versus insurance. But the fact is, you can change that model. But now you have a different session that is added into a coding, and that's all there is. Can it be done? It can be done. Solution can be done. And maybe it's like you said. You mentioned
yeah.
keyword pilot. Maybe someone can pilot it, test it out, and put it to play, and
I
you'll
like
find
it.
the results.
I might steal it from you.
Well, that's just an idea. I mean,
Well,
it's open for anybody to
if you go
grab.
to Eisenhower's ER, there's a whole family sitting in the waiting room.
Here you go. Well, yeah, I mean,
See?
but you believe it or not, these things work. And that's the other thing. There's also the support system, right? If I'm sick and I have my people with me, that can help me heal faster than if I'm
Right,
isolated with
right,
them.
right, right, right.
Just from the mental aspect of it, it makes a difference.
Yeah,
Like when we go to like I had an incident at the hospital recently with my mom. So they have a companionship program where you can be with her, and so you can
uh-huh.
assign someone from the family to be companion. Companion means you can be with her, help her, guide her.
Right,
Basically you're an assistant, with the process with her because you know her best,
uh-huh.
and give her someone that's familiar. So it's a great program. But then, it's not consistent in terms of training. So I got into this debate with them because they said, well, I didn't get my badge officially in the first couple of days, and so I always like a treated as a visitor. I'm not a visitor. I was already with her as such in a different
Yeah,
facility in the same system. It is your policy, and I wanted the same. And I mentioned that when we brought her in, and now so I had the argument with the security and stuff. The next day I made a big sting about it, and then I won the case. I mean, I really made the point that it's a policy, and guess what? They acknowledged that yes, that was the policy. A visitor and a companion is two different things. But I was like, well, why is it not consistent? Why is it someone is telling one story versus the other? If
right,
I tell you
right,
this,
right, right.
I shouldn't be the one fighting about this. It doesn't
Yeah,
make sense. And if I didn't make that big sting, I would have, someone would not be. But I was with mom. It helped her, get better.
yeah.
And by the way, even the nurses, they get a shift. They don't know her enough. They look at the chart,
Right, exactly. Yeah.
what medicine she had and stuff, but they don't know how does she work and stuff. And sometimes that's the other thing that pisses me off, is that every time I have to talk to them about who I am and what I'm doing. That should be in the system. This is the guy to talk
Right,
to.
right,
This
right.
is this
Yeah.
is what you need. Don't talk to her. Talk to him. You know, I'm
Yeah.
like for example, my mom doesn't know. It's gonna sound weird. Doesn't know her age. I mean, she knows her age, but she doesn't know what her date of
Yeah.
birth.
What her birthday is.
You
Yeah.
know, not because she's forgetful, because that's not something she was trained. When she was a kid. It's not like my date of birth is like it was just a different time and era where she was
Yeah.
born and placed. And so when I tell them like, oh, what is can she tell me like, well, that's one question you never get an answer for. So you won't take it from me, or you're just gonna stand hanging there because you're not gonna get an answer.
Yeah.
So she's not gonna give you her date of birth. So let's do something else. I'll
Oh my
save you the,
God. Oh yeah, yeah, I
halal.
hear you. Well, the one
It's
that drives me nuts, the one I every time I go in, they say the same thing. Have you had any falls? Yes, I've had 4 in the past 6 months. Next question. Well, wait a minute. Aren't you going to ask about the falls?
well, they just gotta check it out of the box.
Right,
Well,
you
so
check off the box. Right.
but that's the thing. Like like I don't have to fight for every time I talk to them. Especially if information is already. Now I'm talking about technology. It's already in the system. It didn't
Okay.
change.
So now you're giving me another idea. Okay. So there has to be for the health plans, you have these medical records that's really good at helping you generate lots of charges and you can make a lot of profit. But when somebody notices a glitch, I know they did this in Japan with the cars. They called stop the line. That the nurse, the physician, they're given permission to actually challenge when it didn't work. Because if you don't challenge it at that moment in time, it just keeps repeating and repeating and repeating and repeating. And you hear the same stories over and over and over again. And you're like, don't they realize it's not working? The blockchain, the AI chain is not working. Then why would you keep repeating it over and over again?
Well, they keep doing it until someone challenges, as you said. That's
But
the
it's
thing.
you. It's you.
Well, I mean, it could be anybody, but it just happened
I
that
know, I know, I know.
in my
But
case.
it's whoever
But what about someone who
makes
doesn't
the
have that?
whoever complains the most
That's
is
right.
the one.
But it
And then
shouldn't
they
be.
mark you down as yeah.
But it shouldn't be that way,
I
right?
hear you.
Because not
Okay.
everybody has a voice. Not everybody can advocate on for
Now I have
themselves.
some good news and bad news for you.
I love your bad news comes with the good news. So let's
You're
start
right.
with the bad news this time. What's the bad news?
You are the difficult one. That
Oh,
makes you the social deviant. I'm feeling better about myself because nobody likes me because I do that all the time. And I'm like, see, there you are too. We are the ones challenging the system because we're saying it's not working.
oh,
And there
listen.
aren't, and you at the beginning says this, there aren't enough people who have enough confidence to do it.
Yes, that is fact. Yeah, I mean, but it could be learned. It's. I'll give you a good example. Everybody gets the bill of patient bill of rights. How many people really know what's in the patient bill of rights? Actually, I had another case where my mom. We were in the ER. She was supposed to be taken to X-rays, right? So we take her. I go with her. I got to translate for her. So we go in, and again, I am her companion, caregiver, the one that makes the decision, that talks on her behalf. Not that
Yeah.
she's not capable. She just doesn't speak the language. Therefore, she's not going
Right.
to be able to.
Yeah.
And they don't have the dialect that she speaks, so they can't do it. So that's been made clear. So we get there. This dude, who's the X-ray guy, the tech, I go in. I'm like, like, what are you doing? It's like, I need to be here with her, so she needs to feel comfortable as to the
Oh my
operation.
God.
Whatever
Yeah.
you're doing to her, she's just gonna be frustrated because you're gonna move her, handle her, and she's gonna be scared. So I'm just gonna tell her everything, so this way she knows. So he didn't like me. I was like, well, you don't have to like me, but this is it. You got to deal with me. Now,
Yeah.
here's the thing. So he takes it to the next level. I'm waiting outside. He brings her. He actually didn't even ask for help. He takes her, he maneuvers her, puts her back in a chair in her bed, moves her to the room, does the X-ray, comes out, takes her in front of me to the room. I was livid. I didn't argue with him. The next day, I made a big thing about it, and I made a formal complaint about it. And I'm doing it at the show. And so if they listen to it, and I haven't done a show about the system, because I will do one just about the experience, good, the bad, the ugly. So, whoever is the running the show there, they're gonna have to listen to it. Because when I told them I'm
Yeah.
in the media guy, they didn't realize it. But maybe they will believe that. But the fact is, it was so annoying that, and I went to the Bill of Rights and I highlighted to them communication. You need to be able to communicate with us, and we need to communicate with you. That's actually a big bullet in there. So if you do not know, to communicate what, who, when, what's going on, what's happening, and so on and so
Right,
forth, and if
right.
the person is not able to talk themselves, then the one that is with them should be able to have the same access to that, especially if it's notified. So therefore you get it done. So that's the thing. So for people watching and listening, if you have the same experience, make sure you highlight that up front. I need to know, and I need to know every step of the way. Like I even asked, like, I'm not like the doctors are talking, but they're not telling me anything. I need to know what's going on, and I need to know
Right.
everything. Not just going like, oh, she's this or the other. Spend some time. Even the doctors, I was like, they come in, oh, the 2 minutes they spend with her, like, what kind of,
Yeah.
what are you doing? So
See,
I
okay,
was,
there, yeah, I'm there. Okay, we definitely know there's a problem, and there definitely has to be a different solution. I think the wellness for chronic health conditions is, I guess, maybe what we're talking about that would be different. If they have a chronic health condition, they should not be seen in the ER. So anyone who waits in the ER for more than 5-10 minutes should be triaged to the chronic health management team.
the fact that's a good
And
one.
then there's good. I mean, I'm just listening to you. See, that's the thing. When you start talking and listening, the other person is like, yeah, you keep saying the same thing. It's like, well, clearly the wrong guy's seen you or the wrong program, as I don't know. I think we're onto something. I really think that there's a protocol. There is a AI protocol for acute care, and there's
Wait,
an AI protocol for chronic care. And we need to talk to the family physicians and say, you know what? Why don't you tell us what would work for you? And like, let's listen to them, because I know they get frustrated. They find something like person has cardiac issues, high blood pressure. They have to make a referral to the cardiologist, and the patient has to wait 6 months. Then they get mad at the primary care doctor. It's not, it's like he should be empowered to be able to answer some simple questions and act on them, not have
well,
to wait 6 months for a specialist.
well,
That, I don't know,
that's a
that's an
challenge.
idea,
No, but
because
but you're right.
the health plans are actually interfering with the physician who's been trained to do that. He knows how to do cardiac, simple stuff.
Well,
He knows how to do psych stuff. He knows that, he's got what's within his scope of expertise.
there's one thing that people may not know is that in the health plans, doctor can obtain to have multiple disciplines, attached to their practice, meaning that you can be a cardiologist in internal medicine in the health plan and see patients both ways. You just bill differently if you can credential that way. So that's another thing that may be a challenge. Sometimes, they don't know, they're not afforded that opportunity.
We
But
now agree a challenge is an opportunity.
I like that. That also, we'll take it as an opportunity. Listen, and that's actually a great. That is a great word. There is an opportunity
Yeah,
for better things to happen, for better
right,
process, for better communication, for better outcomes, for better health, for
right.
better wellness. The problem is we just need to all do our part as a group,
Just say
and
yes.
that's it.
Just
I
say
love
yes
it.
to change.
Yes to change. Yes, we can. Right.
Yes, we can. Yeah.
I think was not a campaign, like, political campaign. I think that was Obama's campaign. Yeah. Yes, we can.
Yeah. Yes. Yes. Right. Okay. Yeah. It's
Yeah.
just say yes. Instead of saying no to everything, why don't we just say yes?
Well,
So,
and by the way, with a caveat, you don't just always say yes blindly. Yes has to be with.
yeah, I know. You never say, but don't
Yeah,
say no blindly. Don't say
yeah.
no to everything.
Hold on. You want
Can
some
I use
drugs?
the
Yes.
bathroom? No. Can I have a glass of water? No. Can I?
No, well, no. Like, hey, you want some drugs? Yes. No. So the answer
Yeah,
would
right.
that would that be like?
Yeah, maybe then you say no.
So there is some things that we need to be aware of as to say no. But you guys know we're just having fun here. But fact is,
Yeah.
yes is clear to the good things. The bad things are clear. You say no when you need to. But the fact, if you don't know, ask. That's the other thing.
Right.
Find
Yeah.
find someone that can help you and guide you in making decisions. All right. Well,
Right.
listen, we've
Yeah.
covered
Thank
almost
you.
2 hours
What
here.
time is it? Oh my God. Okay. It's been great. Honestly, so much
It,
fun.
it was
Really.
fun with me as well. So before we kind of close our show today, any advice you want to just leave our audiences with, and then how can people really connect with you and your services?
I think stay tuned. I think for the next couple of months, we're trying something different. We're not, we're more like you. We just are saying, look, if it's broke, fix it. So there has to be a different solution. There has to, it's broken. So let's fix it. Let's not keep looking back and going back in the day, in the day. No, no, no. We're moving forward. Some people have dementia and they're living in the day, but us, the rest of us are moving forward, and we just have to change, and the best part is it's going to be fun. Let's go to the chicken ranch.
I like it. Well, that's it, folks. I mean, think about it, right? Moving forward is a
Yeah.
great thing. Looking forward to solutions is a better thing, and that's all there is. We can't dwell on the past. The future is bright.
Yeah.
We can look at it that way, and that should be full of
Yeah.
good change.
And
So thank you for that.
bring joy to each other. That's so if you can bring joy, then
Joy,
that's an
health,
emotional change.
wellness. That's right.
Right, right. Yeah, I
Awesome,
like
awesome.
it.
Well,
Okay, thank you so much.
you're welcome. So the website is where they can get the information.
Yeah, 360 Wellness Solutions net.
Right.
Yeah, it's not net, not com.
Okay,
Net.
I'll have that on the description of the show so people can also
Okay.
link up and connect and just say yes so they can say yes.
Yeah, that's on there.
Yeah.
Just say yes is on there, and and in a couple months we'll have more out about 360 Wellness Village. We're getting that going, but yeah, that would be a nonprofit that says, you know what, if you feel like doing something different and you want to
Do it.
just try something different, let's just try something different. Yeah.
All right.
So
Well, doctor, it was a pleasure. It was fun. Thank you so much for
you're
the exchange.
welcome.
We've covered a lot of grounds here, so but it's
Okay.
pretty good stuff. Hopefully, people can get some out of it, and
Yeah, maybe
make some
talking
change.
yeah, and we'll be in touch for sure.
We definitely will. All right.
Okay.
So
All right.
folks, this is the end. Thank you, Doc. This is the end, folks. We'll be talking soon. New day, new show, new guest, new topic. Stay tuned. Bye for now.